StudyMEDIC, and again we are here with RRR series, which is specially designed to make your revision optimized. And Dr. Tazeen जी मैम
Recording in progress.
आप होस्ट बन गई हैं खुद ब खुद ही। Hi everyone, Assalamualaikum. This is Dr. Tazeen, and a very good evening to all of you from StudyMEDIC. And we are here again with a beautiful RRR series for all of you, which you have to take care that how this is actually designed to make your revision series optimized. So in today's discussion, I will be discussing with you about the immunology, that what are the important aspects of immunology which you have to keep in mind for your exam, and this will make your revision easier. So again, a warm welcome at YouTube channel of StudyMEDIC, which is actually coming up with beautiful ideas, and this RRR series is among one of those to make your revision optimized, to just help you to crack this exam in one go. And this is actually for you guys. So the ultimate aim is to learn and succeed together, and that's why we are actually here to for this revision series. So always remember one thing in mind, that all the passion, all the dedication which you are having, this is leading you to success, and this should be kept in mind, that this dedication and passion is actually for your success. And all the hustle which you are making today, all the efforts which you are doing today, this is actually an antidote to all of your problems, and you will be successful, and definitely we will meet you in the success celebration of your exam. So that is basically the ultimate thing which should be in our mind. So once again, welcome from Dr. Tazeen at the YouTube channel of StudyMEDIC, and we shall be discussing about immunology in this quick and short session for your revision. So the first thing which we have to keep in mind is that immunology, basically the main function of the immune system is to protect the host from invasion of various infections. Okay, so from the infections you have to protect the host, and that is why the immune system is there. Okay, and immune response, it can be rapid non-specific reaction against foreign invaders, which is known as innate immunity. So the rapid response is innate immunity, and the antigen specific reactions that recognize the pathogenic organisms both during the initial infection and upon subsequent contact with the same organism, that is adaptive immunity, which should be kept in mind. So this difference is very, very important as far as exam is concerned, that what actually is the innate immune system, that is a rapid and a non-specific reaction against the foreign invaders. And what actually is the adaptive immune response? This adaptive immune response is basically that it is antigen specific. specific, while the innate was non-specific reaction. Okay, and this adaptive immune response, it can recognize the pathogenic organisms, whether it is an initial infection, or if it is a recurrent infection, or it is a subsequent contact with the same organism, like the organism it has affected or it has attacked earlier. Now this is the same organism, this is subsequent contact with the same organism, and adaptive immunity has the quality, adaptive immunity is actually capable to identify that organism on the subsequent contact, so which is actually known as adaptive. The innate immune response, it is mediated principally by the macrophages and the neutrophils, and by soluble circulating molecules which we call as complement proteins. Okay, so now the first thing is that you should have an idea that what actually is innate immune system, what actually is the adaptive immune response. Okay, then there comes another point, that what are the mediators, what are the facilitators of this immune system. So for the innate immune system, as I discussed with you, that these are the macrophages and neutrophils, and by soluble circulating molecules such as complement proteins, while for the adaptive immune response, this is by the T cells and B cells. Okay, the innate and adaptive arms of the immune system must interact to generate an effective immune response. Okay, so these two arms, they are there, and for the effective immune system and for the effective immune response, these two, they should work together, and cytokines are the key molecules that control this interaction. Okay, so now there are certain differences between innate immune system and the adaptive immune system. When we talk about the innate immune system, it is the first line defense. It can react in a rapid way to the non-specific antigens, while when we talk about adaptive immune response, this is a second line defense. Okay, innate immune response is non-specific response to the foreign antigens, while adaptive immune response, it occurs in response to specific antigens. There is no memory by the innate immune response. Okay, and the memory is there for the adaptive immune response. As I told you, that if the attack is by the subsequent organism, so this adaptive immune system, it has the capability that it can recognize that pathogen. So the memory is there, which this response is affected by the previous exposure, like infection or vaccines, and it contains memory to identify those organisms or pathogens. For the innate immune response, exposure leads to immediate maximal response. As I told you, that the response is basically rapid response, and this is maximum response, while for the adaptive immune system, there is a time between the exposure and then a time between the maximal response. There is always a lag time between the two. Innate immune system is less powerful system, while adaptive immune system is more powerful system. Innate does not react against the host, while the adaptive immune system, it can even react against the host. Okay, so these are the two arms of the immune system, which are adaptive immunity as well as innate. So one thing you have to remember, that the quick response, the rapid response, and against the non-specific antigens with no memory is innate immune system, while the adaptive immune system, this is a slow response. A lag time is there between the recognition of the organism and the maximum response, but it contains memory, it has memory when the infection is there against the specific organisms, then it contains memory as well. Then certain immunological changes are taking place in the body during pregnancy. As we know that in pregnancy certain physiological changes are taking place. So in the same way, immunological system, it is also undergoing various changes during pregnancy. So this is actually the immunological clock of pregnancy, that how these changes are basically taking place. In the early pregnancy, mobilization of specialized uterine natural killer cells is there, entrapment of antigen presenting cells are there, and then dampened antigen presenting cell responses are there. Okay, then in the mid to late pregnancy, there is progressive enhancement of pathogen responses, and this progressive enhancement, it is taking place through increased neutrophil numbers. So the neutrophil numbers are increased, there is enhanced neutrophil and natural killer cell responses to viral and bacterial pathogens, and there is progressive expansion of peripheral regulatory T cell pool. Okay, while in the postpartum period, these immunological changes, they are not well understood, but it is suspected that they include immunological recovery and resolution, that what all changes which has taken place initially, so it leads to recovery, and maternal tolerance to fetal cell implants also takes place. In a pregnancy, the immunological changes are relatively minor, and these changes include that the total leukocyte count, which is your exam question, that it increases by 30% due to an increase in the neutrophils. The lymphocyte count is essentially unchanged. Okay, although there is an inversion of the normal T to B cell ratio in the first trimester, which reverts to the usual 3:1 by the third trimester. Okay, so certain changes are taking place. Among those, what changes, that the leukocyte count, it is increasing by 30%. A decrease is there in the helper T cells. Okay, and a slight reduction in the IgG and increase in the IgD. Immunoglobulin G, it is increasing. Okay, it is decreasing. A reduction is there in the immunoglobulin G, and an increase is there in immunoglobulin D, and cell mediated immunity is slightly decreased in pregnancy. Then there is basically during pregnancy, maternal cell mediated immune response to paternal antigens during pregnancy, they are basically depressed. This is thought to be result of changes in the T helper 1 and T helper 2 balance in pregnancy. Okay, so this balance between T helper 1 and this balance between T helper 2 cells, it is basically affected. Okay, placenta produces T helper 2 promoting cytokines such as interleukin 4 and interleukin 10, as well as progesterone inhibits the T helper 1 responses. In normal pregnancy, the bias is towards T helper 2 immunity. Okay, so you can say, or you can remember in such a way, that the T helper 1 immunity is depressed and the bias is towards T helper 2 immunity. So all the disorders which are basically mediated through T helper 2, they will get the exacerbation of that problem, and all those which are through T helper 1, they will be having the relief of symptoms during pregnancy. This is how basically it is working. So temporary remission of rheumatoid arthritis would be there. Why rheumatoid arthritis temporary remission is there? We say that the immunological clock of pregnancy, it is shifting towards T helper 2. T helper 2 immunological clock is higher. So as T helper 1 is being depressed, so there would be remission of rheumatoid arthritis, and there would be exacerbation of disease which is caused by intracellular pathogens. For example, herpes is there, malaria is there during pregnancy, and as the pregnancy clock is shifting towards helper 2 mediated immunity, so lupus erythematosus, which is mediated through T helper 2 cells, there would be worsening of lupus erythematosus. Okay, this thing and this concept is very important as far as exam is concerned. They will ask you that why there is remission of symptoms of rheumatoid arthritis. The reason is that it is T helper 1 mediated, so it is being depressed during pregnancy. And then another exam question, it can come in the exam, that why there is worsening of systemic lupus erythematosus. Why there is worsening? That it is T helper 2 mediated, and T helper 2 mediated, the clock is shifting towards T helper 2, so there is worsening of the situation. Okay, so immunology of hemolytic disease of the newborn, basically there is commonest cause of hemolytic disease of the newborn, which is Rhesus incompatibility, which comes in the immunology of that what actually is happening in the hemolytic disease of the newborn. In all cases, maternal sensitization results from transplacental passage of antigen positive cells from the fetus. Okay, so these red cells are likely to pass into the maternal circulation after delivery, after miscarriage, or if there is any a trauma to the mother and feto-maternal hemorrhage is taking place. So these red cells, they likely to pass into the maternal circulation. Only about 25% of mothers, they respond with antibody production. Okay, and ABO incompatibility, it has a protective effect as the fetal red cells are coated with anti-ABO antibodies, and maternal sensitization, it results in production of IgG antibodies, which are IG1 and IG3. Okay, so here you can see that in the first pregnancy, basically during delivery, Rh antigens, they enter mother's circulation through the breaks in the placenta. Okay, so the mother is actually Rh negative, but the baby is Rh positive. So at the time of delivery, there are breaks in this in the placenta, in that barrier. So during this delivery, these cells, they are going into the maternal circulation. Okay, and mother makes the Rh antibodies. Okay, what happens actually in the second pregnancy, that mother is already having these antibodies. So these antibodies, they act against the baby's red blood cells. So these antibodies are actually acting against the red blood cells, and then they are causing the lysis of the red blood cells, which actually is taking place. Okay, immunological interfaces of pregnancies are there. The interface of immunological interface of pregnancy, it is the placenta. It is not the fetus, this is placenta, which is the interface. Okay, that forms the interface with the mother. Then there are two main interfaces. One is extravillous cytotrophoblast and decidua, and the second one is syncytiotrophoblast and maternal blood. Okay, so the first thing which you have to remember is that what actually is the immunological interface of pregnancy. So this is basically placenta. So what part of placenta? The other thing which you should remember, that is extravillous cytotrophoblast and decidua, and then syncytiotrophoblast and maternal blood. Okay, these extravillous cytotrophoblast cells, they do not express the classic class 1 antigen HLA-A and HLA-B, which are the principal stimulators of graft rejection. They do express the classic class 1 antigen HLA-C. So neither the invasive extravillous cytotrophoblast nor the syncytiotrophoblast, they express the class 2 major histocompatibility antigens. Okay, so which exam question is coming up? Which histocompatibility antigens are being expressed by these cells? So the extravillous cytotrophoblast cells, they do not express classic class 1 antigens HLA-A and HLA-B. Okay, they do express which one is being expressed by them, that is HLA-C. Okay, that is class 1 HLA-C. A and B is not expressed. So class 2 is not expressed by in neither of them. Okay, so this is the thing which you have to remember. So the interface 1, which is formed by the extravillous cytotrophoblast, which invades from the tips of the chorionic villi into the decidua in the early stages of pregnancy, it to anchor the placenta to the uterine wall. It forms a tissue interface, and it plays an important role in the first trimester. The second interface which we remember is that is the surface of chorionic villi, which is the syncytiotrophoblast, and the maternal blood across which the exchange of gases and nutrients occurs. Okay, so it forms tissue and blood interface. Okay, and more important in the second and third trimester. Okay, so that is very important. So placental immunology is important, that it causes the prevention of fetal graft rejection. Okay, immunological protection against rejection is caused by the following mechanism: that there are placental hormones, which are proteins, early pregnancy factors. Okay, then it is pregnancy associated plasma protein A, it is steroids, which are human chorionic gonadotrophins. Okay, then it is basically which is having the immunosuppressive properties. Okay, so it is having the immunosuppressive. Villus trophoblasts do not express HLA class 1 and class 2, and extravillus trophoblasts express only HLA class 1. And there is shift in the maternal response from helper 1 to helper 2, as I discussed. That's why there is remission of rheumatoid arthritis and exacerbation of lupus erythematosus. Okay, and decidual natural killer cells from the extravillus trophoblast, they regulate the invasion of trophoblasts in the spiral arteries. And syncytiotrophoblasts have lymphocytes, cross-reactive antigens, which protect the fetus from the rejections. The decidua contains diverse population of cells like stromal cells, lymphocytes, uterine natural killer cells, and monocytes. Less than 10% of decidual cells are leukocytes in proliferative phase, to 20% in late secretory phase, and 40% in early pregnancy. Okay, and the increase is mainly due to rise in the number of natural killer cells, which comprises more than 60% leukocytes. Uterine natural killer cells, they can regulate implantation by different cytokines. So these are the colony stimulating units. Okay, and leukemia inhibitory factors also by inhibitory cytokines as interferons gamma and tissue necrosing factor alpha. So these are the immune cells decidua, which are T lymphocytes, and these are the dendritic cells macrophages. Okay, T lymphocytes, they decrease in number, and dendritic cell macrophages, they increase in number. Okay, so these are the changes. So fetal development is taking place. The first hematopoietic center, it develops in the yolk sac after 4 weeks of embryonic life and lymphocytes, and then B cells appear in the peripheral blood from 12 weeks and mature T cells from 14 weeks. The rise in the immunoglobulin is seen in the second trimester, and it is caused by placental transfer of maternal IgGs. And immunoglobulin M, it cannot cross the placenta. It is a macromolecule. However, it is the first antibody which is fetal in origin, and the baby is forming it in the body, which is being formed by the baby first, that is immunoglobulin M, while immunoglobulin G is crossing the placenta. And these are the various gestational ages where the innate and immunity is taking place. So at 5 to 6 weeks, macrophages in the liver and blood. 9 to 10 weeks, they start the complement synthesis. Okay, then 12 to 14 weeks, macrophages in the lymph nodes and antigen presenting cells they are circulating, that cells, they start secreting the antibodies, and gradual increase in the T basically also there in the IgG transposition. Okay, so at 12 to 14 weeks basically is the start of mother's IgG transfer. Okay, that is also your exam question, that at what gestational age basically there would be transfer of immunoglobulin G. Okay, so this thing you have to remember, that immunoglobulin G is the one which is crossing the placenta and which is reaching the mother, while immunoglobulin M, it is macromolecule, it cannot cross placenta. However, it is the antibody which is the first antibody of fetal origin. The baby forms which antibody for the very first time? That is IgM. IgA is found in the secretions, while IgE, that is found in the anaphylactic reactions. So this is how they can ask you in the exam. And then again, these all these gestational ages are important, that what actually is happening, that at what time macrophages in the liver they will start forming at 5 to 6 weeks, and T cell precursors are there in the liver. Then at 9 to 10 weeks there would be start of the complement synthesis. Okay, and B precursor cells will start forming in the liver, whereas T cells would be there in the thymus. Okay, then 12 to 14 weeks is the time period. Then macrophages in the lymph nodes and antigen presenting cells, major histocompatibility class 2 molecules are there. And also this is the time which is actually important, that when the start of mother's IgG transfer is taking place. At the 12 to 14 is the gestational age when IgG start transferring through placenta to the mother. 16 to 17 is the mature macrophages in the liver and circulating neutrophils, large number of B cells in the spleen, blood and bone marrow, and T cells in the blood and lymphoid tissues. And 20 to 30 is the time period that when the B cells, they secrete antibodies, there is gradual increase of T lymphocytes secreting the lymphokines, and there is gradual increase of IgG transportation. So this is basically, it's this transportation, it is starting at the time of 12 weeks of gestation, and there is increase in the transportation at the time this time. So this was all about the important concepts of immunology which can be asked in the exam. So you should have a very clear idea that what is actually the innate immune response, what is the adaptive component of the immunology, and then you should have clear idea that what immunological changes are taking place in the pregnancy, what are the mediators of those immunological changes, and what actually is the shift that it is towards the T helper 2 cells, which you have to remember. And then at what gestational age the changes are taking place in the in pregnancy, and at what gestational age the transfer of immunoglobulins is starting, at what gestational age this transfer is maximized. Okay, and when the hematopoiesis is starting in the yolk sac, when the liver is taking over, all these things, they are very very important. As far as another exam question which is very important, that they will ask you that which antibody is crossing the placenta to reach the mother, which is immunoglobulin G, and which antibody is formed by the fetal origin is immunoglobulin M. Again, the in the secretions it is present immunoglobulin A, and in the anaphylactic reactions it is immunoglobulin E, which is there. Thank you so much for joining this session. Thank you so much for attending this session. And if you get any queries, you can post your queries in the comment box of StudyMEDIC YouTube channel. And if you have not subscribed the channel, subscribe now so that you can stay updated with the upcoming videos. Thank you so much. Have a great day.
Recording stopped.